little boy died. Clearly, there were lots of other factors that played their part to play. But as a result of the Barway Garber case, actually, that kind of shone a light more on the Support to Return training programme. Jeremy Hunt, who was the health minister at the time, phoned up, and I think it was Wendy Reid, but certainly phoned up someone at HE and said, look, this can't happen again. We'll give you some money, which is obviously unheard of, to plough into a Support to Return programme so that we can at least try and help trainees that are returning back into training out of a period, having had a period of out of training. So there's been lots of evidence into the Support to Return training. The Academy of the Medical Royal Colleges did a piece of work in 2016 and 17, whereby they asked a whole load of trainees how they felt about returning to training. And as you can see from the graph, they're all the things that you probably are feeling or have felt on your return. And they're things about you know, being worried about your clinical practice, skill fade, where you're returning to, if it's somewhere you haven't worked before, the organisational culture about this, who's going to meet you, when's induction, all those administrative things that, although they seem small, actually do play on your mind until you actually do them or someone contacts you. The one thing, though, that really did shine out, which is the orange. Hello? Oh no, go back. Sorry, Vanita. The one thing that did shine out was confidence and resilience. And people did express the fact that they were nervous about going back. What they also showed was 10% of trainees are on OOP at any one time, which is quite a large number of trainees. And there was also some American data that showed 67% of returning trainees reported they had skill fade. And this was influenced by the length of time they had out and also age, but I'm kind of going to skip over that bit about age. What's interesting is that the Support to Return programme is really for anyone that's been out of practice for more than 3 months. But, you know, someone that does a PhD might have been out of training for 3 years. As well as my Support to Return champion hat for Clinoncs, I also do some educational stuff for my trust, and I was also the Support to Return trust champion, and I did a small survey within the trust asking people also how they felt about returning to training. So this was across speciality at different training grades, and it's all the same kind of stuff. So that feeling of it being an imposter, the fear of being able to balance, you know, all the stuff that you may have forgotten with also putting your game face on, which I'll come to in a second in my own story, and the worry about the fact that you might have forgotten some of your skills, and obviously that then leads to patient safety issues, but also whether you were going to get support, if you were going to have a lovely ES that might, you know, help you and make sure you weren't on call the very first day you walked into the building. And then for the maternity leave returners, that if it's your first time or even your second or third time that you're, or fourth, thinking about whether you're going back full time or less than full time, juggling what's going on at home with what's going on at work, the lack of sleep you might get. Some people reported that they were going back breastfeeding and hence you know, what they would do about their milk and if they leaked at work. So all those kind of things were playing on their minds, as well as actually having to return to work. So there is quite a lot of work that's been done into trying to build up this programme and facilitate a better transition back into training, having had time out. So just so that I wanted to just share my story, and then Romelie will share hers. I started training in 2006, which is obviously quite a long time ago. Passed my part 1 and then promptly got married 3 weeks later, and then went on mat leave just under a year later. And I took 14 months out. And when I first returned, I remember that feeling of I'd negotiated less than full time. I'd come back 60%. Those of you who are returning having had children or have children know that once you put them in nursery, they pick up every snot cold virus going. So that kind of feeling of when you return, what happens when your child is ill and it hits the few days you're actually at work, so navigating that. I actually went back to work for a really formidable woman, it was at UCH, she now doesn't work there, who didn't have children, and I remember being quite nervous about that. But I have to say, throughout my 11 years as training as a trainee, she was probably the most supportive to me, working less than full time with children. I then went off again 2 years later to have my second child, returned 14 months later, and actually returned to UCH. But instead of my first day back at work, going to UCH, being warm and cuddly and supportive, I actually was told I had to go and do an outreach clinic at Welwyn Garden City as my first day. Arrived at 8:30 at Welwyn, or it might have been 8, to find out the consultant was in the MDT and I was to run clinic on my own until she arrived. And that was my experience. I actually don't remember being phased about it at all, but what I do remember, even 10 years on, is leaving Welwyn with a stinking headache. So I obviously had some background stress. I then passed my Part 2A, was very heavily pregnant at the time, went off again on my third mat leave, returned again to sit the rest of the exam, I think about 8 weeks later. So I don't actually remember being phased by my return at all, because all my focus was on passing my Part 2. And then I went off again for another year. You can imagine what my ARCPs used to be like. I went off again for a year's education fellowship, which was an amazing year. I would highly recommend taking years out to do whatever kind of floats your boat, whatever your interests are, be that research, education, management, whatever, you know, keeps you going. You have to have a balance, both with clinical work and other stuff. So I just want you, if you can, to write in the chat, which do you think, my return from those 4 oops, which do you think was the hardest for me? First, second, third, or fourth? Play the game, please. Love it, thank you. So I think half of you are right. If we move on to the next slide. It was my fourth. And I'll tell you why. And this, I think, is really important, actually, because, and it goes even for consultants returning having had OOP. You assume that if you're coming back having done this quite a few times, it's a piece of cake. And also you come back quite senior, it's a piece of cake. It's quite the contrary. And just bear this in mind when you're coming back. You might have similar feelings to how I felt. I was returning back to a department, post-FRCR, you know, I can sign radical plans. When the consultant's not there, I'm the go-to person. I'm probably the most senior trainee in the department. This is what I was going back to. I hadn't done any clinical practice for a year. It was a department that they had discussions about, you know, if a consultant job came up, and I was quite keen on also getting a consultant job there. So I was coming back, terrified I'd had skill fade, have to put my game face on because I don't want to look like I really don't know what I'm doing. And all that plus going back was actually the hardest experience. And I distinctly remember being on the train going back for my first day, and one of my friends who works for Goldman Sachs got the train with me. And anyone that knows me, when I revised for my Part 2, I had these exercise books, and I was reading my exercise book for urology because that's what I was doing, and she asked me what I was doing, and she was astonished that there was nothing to do with supporting trainees or consultants back after training. And it was very clear that in her line of work, so Goldman's, they had a whole package, they had a whole process, and there was nothing for us in my field. Obviously, things have moved on slightly. That was 2017. So the program was there for certain specialities, and it's now started to filter into others. But it's just to take note, it doesn't really matter what stage you're going back, what age, what degree of seniority, that you're still going to have feelings and difficulties going back. So Romelie is going to talk about her experience going back.
Yeah, can you hear me? So I've only got one slide, and I've had a completely different experience because as some of you know, I had an accident. I had a slip disc, completely unexpected. Absolutely didn't think that there was any real lead up. I had a bit of a stiff back for a bit, and then got out of bed one morning, and then all of a sudden I had this progressive neurology down my leg and couldn't walk. And so my time off was relatively unplanned, unexpected, and that I think is what I found so difficult all the way through, and why and probably added to why it was stressful, and why I'm here trying to be supportive for other people who might go through similar things. So I ended up having to take almost 4 months off work, and I had surgery sort of a few days after my initial accident at George's for decompression. And my surgeon was like, oh, you know, you'll be fine, really, you know, completely, as a surgeon should be, mega confident with his own skills, and saying that I'd be completely normal within a few weeks. And but I had no acute improvement in my neurology. I couldn't walk after the first few weeks. And so that just sort of, all of that uncertainty about, would I recover? If I recovered, how much would I recover? If I could go back to work, what could I do or not do? How would that make my day-to-day be okay? Is there other stuff that I need to do on top? How is that going to change my career goals if I wanted to do research, but you know, I've used up all this time, should I take it? Then I was offered all the time that I took off sick. They said, we can count that as full-time working if you'd like, if you don't want to change your CCT date, or you can not include it, depending on your choice. And then, of course, when I returned back to work, my working pattern had to change. And so I think, you know, my experience is really just, maybe like everyone else's, just to say, I suppose I've come to terms with the fact that probably at times I found it really challenging to know what the best thing to do was. And my advice to others would be just to take it one step at a time and trust yourself. And if you're worried about something because you're not sure, then believe that there is a problem, and go and seek help, support, talk to people, because it makes all the difference. And then if you're not, you know, ready, or you're not, you know, with sickness it's a bit harder, but you know, maybe just remember that there's lots of people in a similar boat to you. Even if you think it's very unusual, then loads of people have been through the same thing. And then you start talking about even my experience, and you realize it's really not unique, it's not special, it's not you know, it's just probably what everyone has been through. So just for 2 minutes then, just to say about how really the things that I found really helpful. I obviously had to use occupational health a lot. I would go, if anyone has to go to occupational health in the future, go with a plan. They were very good the first time, because they just said, when we stop having any expectations, you will not be going back full time in 2 weeks' time, just relax. But after that, it was very much up to me. They asked me what my surgeon said, and therefore that was unhelpful. But the best thing they did was to encourage me to think about all the options, all the possibilities, taking years out, changing my time. They insisted that I go part-time and that I start 3 days a week, and they supported me to do that. And that's really easy to do. You just go online and you click a button, and then it happens all. So these things about changing how you work, maybe you all have all done them, but I found that particularly easy. And then for my own personal well-being and getting through it, the two things I found most helpful were peer support and this coaching and mentoring advisorship. So for peer support, just getting involved in the gossip again in the hospital that you're going back to, knowing your consultants, what job you're going to do. It's just like, so if anyone is going back in the next 3 months, I would totally advise you all to, as you will naturally, get on your WhatsApp group and chat and meet up for coffee, and just even if it's just the week or so before, so you get in the mindset, because it really brings you back very quickly. And then I went to on speaking to other registrars, and I think it's always helpful, you know, we were speaking, even Vanita was saying, you know, we've all been there, and actually we don't talk about it enough, but lots of people advised me to join this coaching and mentoring thing, and I thought it was very strange, because I ended up doing 4 weeks of coaching and mentoring on career decisions, but I already had a career. I had not any decisions that I wanted to move out of it, go part-time, change my career. So the idea of having mentorship for something I was very confident on was a bit odd, but it really gave me an opportunity when I didn't want to talk to anyone else about, like, you know, moaning at home. You just want to get on with stuff. But with your coach, you can talk about how it changes, how your personal decisions change, and working part-time and stuff like that, giving you some more self-confidence. And for me, the best thing that they told me ever was just don't go back and do the same thing again, because if you've got a really cool opportunity, or you're now, if anyone, if you've gone maternity leave, or if you've had sick leave, or if you've had research, or if you've got any kind of life experience, you're not the same. So you're not trying to go back to work and be the same person. You've got all these added wonderful things that you've learned, like carry those with you. And I've stayed part-time, and I've really enjoyed that, obviously. There's a slide on the practicalities of going to the mentorship and coaching thing later that Vanita will show, but it's very easy. You just go online, there's an email address, and you meet with someone, either in person or online now, up to 4 times or as many times as you need. Your conversations are your own, and they're really good at pointing you in a good direction. So if that is something that you would do, then that's all I have to say as an encouragement slide. So this is a video.
This is a video. Sorry. This is a video that I put on. It takes about 10 minutes, so not to watch now, but do click on it. It was produced by Bart's Med Ed team, and it basically depicts lots of different grades and specialities of doctors, so trainees and consultants, basically expressing how they felt about returning. It's a really good video to watch.
So I'm just going to quickly talk through the supported return to training program that is on offer. And I think most of the clinics, you will have received something from Sarah outlining what the program offers, but to maybe the medoncs, you might not have received this. So I'll just quickly go through it. So as Sarah said earlier, it's offered to people who've had at least 3 months of absence. So I'm hoping that's most of you on this call. And it's to help try and tailor a bespoke to return to work plan for you all. And so that's where, and it obviously came off the back of the whole Baragaba case that Sarah mentioned earlier. So just briefly running through what the program entails. So it's really about having meetings, first of all. So it'd be good to see how many of you have had meetings scheduled before returning to work, or for those who've already returned to work, did you have a meeting prior to going back to work? So if you could raise your hands, that'd be interesting to see. So I've got 3. I don't know if anyone else is, I can't really see. It's only 3 people. Okay, that's interesting. So yeah, you're essentially the whole plan of the supported return to work program is that before you go off, you have a meeting with your educational supervisor or training program director just to discuss what this is going to entail and sort of maybe plan for when you come back or what you're going to be doing while you're out of training. And then coming back, it's recommended you have a meeting at least 6 to 8 weeks prior to going back, just to discuss how you're feeling and also whether you want to change to less than full time, which Sarah's going to go on to talk about a bit more in detail later. But yeah, whether you do that and whether you want to go back supernumerary for a bit, so actually have some help with your on-calls so that it takes off the pressure from and the stress from you guys from going back. And then generally when you get back to work, you're hopefully meant to have another agreed meeting. So it should be 3 meetings at least as part of this program. The other thing to mention is that there is funding available to all of you, so up to £3,000 to use for refresher courses, and £1,000 per week for the first 3 weeks of you returning to training to facilitate a supernumerary role, and so contribute to paying for a locum so that you have that buffer and it reduces your stress. And then the last thing I wanted to talk about is the professional support unit. So the professional support unit is under Health Education England. It's free for all doctors in training. There's a link at the end of the PowerPoint which you can go to, which takes you to that page. But it's a self-referral process, and I've used it and found it very helpful. Just generally, not even about supported return to training, just generally with life decisions and doubts that I may have had about careers and things. So coaching and mentoring, as Romelie mentioned, is part of that. So you get up to 4 sessions. There's 2 types of coaching. I think it's really good in terms of just generally deciding on what you want to do, even if it's trying to help devise a strategy of challenges you might have at work. So it's more about interpersonal skills. So if you're someone who, like me, finds it very hard to say no and therefore gets bombarded with work and then stays late, you can actually devise strategies to help with that and actually change and reframe your thinking and your self-limiting beliefs. So that's something that's very helpful. And yeah, as Romelie said, I would highly recommend it. So back to Sarah.
So I'm going to very quickly talk about less than full time because we're eking into time. But if any of you are thinking about going back to work and changing how many hours you work, I would suggest you have these discussions with your ES or your TPD or someone you really trust at the place you're returning to, or it doesn't necessarily have to be that, about changing to less than full time. It has it has financial implications, educational implications, but it's also about balancing your work-life balance. Give as much notice as possible, both to your TPD and HEE, so you at least need 3 months notice. The cutoff is 12 weeks to put your form online for HEE, but one of the hats I do hold is that I'm the Deputy Director of Med Ed at the Royal Free, and my work stream is less than full time trust champion as well. So, you know, I get at least 1 email a week from a trainee saying they haven't been paid properly. And when you actually backtrack it all, it's they didn't get their form in on time. And there are lots of steps that go through HEE to your trust to then get you paid. So I would give them as much notice as possible. That is the link to the form. It's a really easy form that you apply online. Back in the day, we used to have to do a form every time we came back from our mat leave, and you had to go and get signatures from various people. Gone are those days. It's really easy. Just do the line and do the form online and give as much notice as you can. There are 3 categories, really. First and second are most relevant to you guys. So category 1 is if you're applying less than full time because you have caring responsibilities or due to health. Generally that's never really turned down. Category 2 can take a little bit longer for people to decide whether they're okay about it. And that's if you're going to have short-term responsibility on a national committee, or you're developing another skill, or developing another career choice, or you're training to be a rabbi or a priest or a vicar. And I have had recently someone that's done this, and those are Cat 2s. Cat 3 was introduced a few years ago as a pilot scheme for ED doctors because they were getting burnt out. It's now expanded into OG, O&G and PEDS, and actually, watch this space, it will be coming into everywhere soon. And then you don't have to give a reason to be wanting to go less than full time. And what I would say to you is, if you are considering this, you need to think. I put this slide up to a talk I gave at the RCP with consultants, so it was very much about job plans for consultants. But I would say it translates to training as well. You need to decide for yourself where your red line is, and then decide, and that goes for how much you want to work, how many days, what hours, etc., and work out where your red line is, and work out what's acceptable to you and what's not acceptable. And obviously that's balanced with the rest of everything else going on in your lives. If you're going less than full time, generally there are 3 ways you can do this. So 1, you're in a full-time slot, which basically means you say, I don't work on a Friday, or I don't work on a Thursday, Friday. The only downside with this is now that we can all get our emails on our phones and our iPads, and we never actually ever stop working, it's quite difficult to say no. Some of us find that difficult. The other way is to slot share, and I did most of my less than full-time training as a slot share. I had some amazing job share partners. Rachel Lewis and I job shared for quite a long time, and that was great. Sometimes you don't get paired with such a brilliant pairing. So there are great bits and less great bits, but that's generally how most people will work less than full time. And then supernumerary is pretty much extinct now. It's where basically you get paid, but you're in addition to other people working, and it's pretty hard to get funding for that. And then lastly, I just want you to think about this, and I really appreciate your feedback when you fill out your forms. COVID's changed how we work, full stop. And a lot of us now are able to have access at home, both working and for radiotherapy planning. You can call in to MDTs and meetings. Most people's MDTs are now virtual. And so I just want you to have a think about, does that maybe change how much you may consider working as a less than full-time trainee? would maybe, I think if I reflect, I work 60%, and if I could have done some of my work maybe 1 day a week flexibly at home and have the ability to pick the kids up, maybe I would have extended that to 80%. So I've had these discussions with head of school. He was quite keen also to find out. So I'd really, really value your feedback about, just think about it and think about if you could work from home maybe one of the days, whether that would increase how much you would want to work. And interestingly, this slide of the very scary Willy Wonka was again a talk I did at the RCP. And that was very much when COVID hadn't changed how we worked. And people always raised an eyebrow and said, oh, you're working from home. How much work are you actually getting done? But now things have changed, culture's changed because of COVID, and people are, including, you know, consultants who work full-time, often working from home 1 day a week. And so just think about it, and I'd be really interested to hear your responses.